friends. So great evening to everyone. I think everyone will be excited to hear this session. That is so excited about today's session. Even me too. I am also too excited to hear about get more information about fatty liver. So we all know that 1 among 4 adults are suffering from fatty liver nowadays. So let's get knowledge about fatty liver. What is fatty liver? What are its symptoms and how it can be whether it can be reversed or not, all the details. And so first of all, I thank everyone who have joined this session. I congratulate you all that even though if it is a Sunday and that too at 8 p.m., you all have joined, like you have more concern about your health. So that's a great effort which you have done from your side. So we are going to have a wonderful session from the speaker is nothing but none other than one of the Dr. Vincy Justin. So she is a DNB and family medicine. So she is from Virdachalam, Tamil Nadu. So she studied her UG from Nasik and she did her PG from Vellore and she worked in CMC Vellore after her PG. So currently she is having a private practice in Virdachalam. So she is passionate about reversing lifestyle disorders. So let's carefully or listen carefully and take the points, and even you can relate yourself if you are having any of these symptoms, so you can contact later. Okay, so I invite Dr. Vincy Justin to the digital stage. Yes, now it's yours. Stage is yours. Unmute yourself, Dr. Vincy.
Sure. I'm just sharing my screen. I think it's visible, right?
Yes.
Yeah. So today's topic is on non-alcoholic fatty liver disease. So what is the point for, let's say, what's the point of this discussion, Zoom discussion today? So the purpose is to educate and you all about lifestyle disorders like type 2 diabetes, hypertension, obesity, PCOS, thyroid issues, Alzheimer's, cancers, and NAFLD. So we as a community want to break the ice when it comes to the management of lifestyle disorders. And this is a very scientific method, and this method is always there, but it's not being implemented. But why? Well, there are many reasons to that. One is lack of nutrition education to medical professionals like me. The big pharma industry who are promoting a lot of their drugs. Then you have the food industry who is promoting food that is not considered food whatsoever. So I urge you all to keep an open mind, think, become curious, do your own research after this session. The facts are all out there. Just make an effort to search for it. So now let's get into the topic. So earlier fatty liver was only associated with alcohol, as we all know, but it's only in the mid-1900s that they found that fatty liver is not associated with alcohol alone. So there are some other reasons to that. So we have to find out what are those. So as said, NAFLD is now called as MSALD, that is metabolic dysfunction associated steatotic liver disease. Steatosis means accumulation of fat. So as the name suggests, this has a metabolic connection. So let's find out what's that. So basically, there are two types of fatty liver disease. It's the alcoholic fatty liver that we all know and the non-alcoholic fatty liver disease. So here in this session, we are only talking about non-alcoholic fatty liver. We'll just take a look at a small video, which will give a gist about what I am going to talk about today. So this is a video showing about our hepatic cells. These are our hepatic cells. This is our liver. So the liver carries out many functions in our body by these specialized cells called hepatocytes. So excess glucose in the hepatocytes are converted to fatty acids, and this is known as de novo lipogenesis. Now, hepatocytes are also key regulators of lipid metabolism. So they take up fatty acids from the blood, assemble them with glycerol, and produce triglycerides. So a high carb diet or a lack of physical activity can lead to NAFLD, that is accumulation of fat in the liver cells. And also what happens is individuals associated with metabolic disorders like insulin resistance, type 2 diabetes, obesity are a higher risk to progress to NASH, that is inflammation in the liver cells. So now what happens is there is activation of inflammation and inflammatory mediators, which leads to inflammation of the hepatic cells. And this causes a cascade of reactions further leading to accumulation of white blood cells and also ballooning of the liver cells. That is, the liver cells start to swell up in size. So this is what happens, the ballooning of the liver cells. So ultimately, the NASH, that is non-alcoholic steatosis, is represented by steatosis, inflammation, and ballooning. So these are the three histological appearances of NASH in the liver cells. Further than this leads to fibrosis, that is accumulation of fibrous tissue into the hepatocytes, further leading to cirrhosis and liver failure. So this can also cause increased risk of cardiovascular events. That is because of the pro-atherogenic lipid profile, that is high triglycerides and low HDL. There is also blockage of the arteries. So it is proposed that a significant proportion of people are going to be affected by NASH globally, and it will eventually become one of the leading causes of liver transplantation. So this is just a gist. We'll get back into our session. So what is the prevalence of non-alcoholic fatty liver disease in India? So according to the study done in 2022, which included around 2,900 children and 23,000 and odd adults, they found that 1 in 3 adults or children have NAFLD in India, and that is a very alarming number. So NAFLD is one of the most common of all liver disorders. It is, as we saw, it is the most frequent cause of chronic liver disease and the most common cause of end-stage liver disorder needing liver transplantation. Let's look into some of the functions of the liver, as we need to know how important the liver is. So the liver removes excess glucose from the blood and stores it as glycogen. And further, it can reconvert glycogen back to glucose as and when needed. And 50% of the total cholesterol synthesized comes from the liver. And cholesterol is a very important structural component of cells. It is also a precursor to all our steroid hormones, vitamin D, bile acids. Liver stores our fat-soluble vitamins like A, D, E, K. And it also stores vitamin B12, iron, and copper. It also produces certain hormones and enzymes which are essential for our body, like precursors of vitamin D. It produces proteins, which are the building blocks of our body. It produces bile, which helps in the digestion of cholesterol. It also deactivates many toxins and poisons. It also kills bacteria and virus via the macrophages in the liver. And so as we can see, liver touches every aspect of human metabolism. And when the liver is affected, all these functions are compromised. So the spectrum of NAFLDs, initially there is just simple fatty liver disease. There is fat accumulation, followed by which there can be certain triggers of inflammation within the cells and the blood vessels of the liver. And now there is transition from simple fatty liver to a very inflamed state called as steatohepatitis. And this is when scarring begins to happen. And the next stage will come is cirrhosis, that is where there is fat accumulation plus inflammation leading to necrosis, that is death of the liver cells, and which will eventually lead to complete fibrosis and cirrhosis. What are the risk factors leading to NAFLD? So the first and foremost is insulin resistance. Insulin resistance further, which leads to type 2 diabetes, obesity, high blood pressure, hyperlipidemia, and also a sedentary lifestyle, poor nutritional quality because of just eating a high carb diet, sleep apnea. I would like to mention a few drugs that can cause hepatic steatosis, like amiodarone, aspirin, chemotherapy drugs, glucocorticoids, methotrexate. These are all taken as long-term, and that's why the problems that it can cause hepatic steatosis, and even tetracyclines and valproic acid. So we're talking about metabolic syndrome. So what is metabolic syndrome? Metabolic syndrome is when a person has 3 or more of the following criteria. What are those? Like it's a blood pressure of more than 130/85, HDL of less than 40 milligrams per deciliter in men and less than 50 in women. Waist circumference of more than 40 inches for men, more than 35 inches for women. That accounts to the obesity part of it. Triglycerides of more than 100, not 150, but more than 100 milligrams, and a fasting glucose of more than 100. So this is a natural history of NAFLD, where once there is simple accumulation of fat in the liver, that means more than 5% of hepatocytes are filled with fat. This can progress to steatohepatitis, where there is steatosis, inflammation, hepatic ballooning, as we saw, and fibrosis. Up to this point, NAFLD is reversible. By lifestyle changes, it is definitely reversible. But beyond this point, it is not. That's when, after this progression to cirrhosis, it will lead to liver failure, and which will need liver transplantation or cause death. And 1 to 2% of these cases can progress to hepatocellular carcinoma, which is the primary liver cell carcinoma. So how does fatty liver develop, by the way? So fatty liver has nothing to do with consumption of fat. So as I mentioned, root cause of fatty liver is insulin resistance. That is, NAFLD is a pathophysiological response to chronic excessive carb consumption. That is, eating too much of sugar and starch. Now, there are two pathways. One pathway is fat leaking from the adipose tissue, and the other pathway is de novo lipogens. So what is this fatty acids? There is always breakdown of fat in our body when the insulin levels are low. But when these fats are broken down, these fatty acids are taken by the liver. That's the job of the liver, to take in the free fatty acids. And then, because of which there cannot be, or there can be accumulation of fatty acids depending on other factors, fatty acids, which leads to NAFLD, or they can be de novo, that is, liver can make fat from scratch from glucose or fructose. So these are the two pathways which lead to fatty liver. So there was a study done by Lambert et al. In 2014, which showed that subjects with fatty liver have more than 3-fold higher rate of de novo lipogenesis, that is, glucose or fructose getting converted to fat. So fructose is entirely metabolized in the liver. So liver directly converts fructose to fat. Fructose is not metabolized anywhere in our body except the liver. So fructose also is one of the causes of fatty liver. So let's talk about the role of insulin. So insulin, as we all know, is one of the key hormones produced by the beta cells of the pancreas in response to high glucose. Never mind if you're a diabetic or a pre-diabetic, even in a normal individual without diabetes, you take a high carb diet, that high carb diet will cause your sugar levels to rise, which will cause your insulin to be secreted in higher amounts. And insulin is a key hormone and tells the body what to do with energy. That is, it will tell the body what to do with sugar as well as with fat. So what happens? If the insulin levels are low, liver will burn the fat. It cannot hold on to the fat. It has to burn it. So there is continuous burning of fat. In situations where insulin is high, liver will tend to store more fat. So that is the physiological response. So when do we suspect NAFLD? So history-wise, there can be fatigue, there can be malaise, abdominal, right upper quadrant, abdominal discomfort, abnormal liver enzymes, presence of insulin resistance, as we discussed, the metabolic syndrome panel I said, obesity, morbid obesity, BMI of more than 35, type 2 diabetes, obstructive sleep apnea. So these are times when you should suspect an NAFLD. So what happens? How does glucose or increased insulin cause fatty liver? So when you take a high carb meal, there is increased blood sugar. In return, the insulin increases. But what happens after some time? The blood sugar level decreases, there is hunger, and the person tends to eat 6 to 8 meals per day, leading to intermittent eating rather than intermittent fasting. So to cope with this, the pancreas will release more and more insulin. So there is hyperinsulin in your blood, which leads to insulin resistance. That is, the cells become insulin resistant. They do not act. They do not allow the insulin to act on them. So that's the reason why insulin will cause fatty liver. And some people develop insulin resistance later in life, that they tend to become more obese. They accumulate fat more. And the people who develop insulin resistance earlier are more prone for type 2 diabetes. So these are the two types of people who develop insulin resistance. What are the symptoms of fatty liver? So symptoms of fatty liver can be simple like fatigue or abdominal discomfort, but as it progresses to cirrhosis, you can see easy bruising, abdominal pain, dark urine, jaundice, pale stools, excessive fatigue, because the liver is not able to function to its full capacity. So how do you diagnose? So increased liver enzymes like increased AST, increased ALT. AST is to ALT ratio more than 1. Ultrasound abdomen, MRI scan, fibroscan, that is the NFLD fibrosis score, and liver biopsy is the gold standard. So the other labs for metabolic syndrome we have to do is CBC, HbA1c, renal function and thyroid function test, LFT as I mentioned, that is liver function, lipid profile, fasting insulin, which will detect insulin resistance, vitamin D and B12 levels. So this is this is the scoring of the fibroscan, that is F0 to F1 is absent fibrosis or even very mild. F2 is significant fibrosis. F3 is very severe fibrosis and F4 is cirrhosis, at which point it becomes irreversible. This is just to show how a fibroscan appears. So changing our perspective is how we should respond to this kind of metabolic diseases. Insulin is a key responder to glucose, but it has toxic consequences. Increased insulin is the reason for metabolic syndrome, which in turn is the reason for causing NFLD. Human beings are designed to be in ketosis. What do I mean by ketosis is when you burn fat instead of sugar for energy. So when the liver continuously burns fat, there is no accumulation of fat in the body, either on the viscera or in the subcutaneous area. So fat is not the cause of NFLD, but it is high sugar, high starch, and liver is the driver of obesity by turning sugar to fat. Protein is a nutrient and it is not a primary fuel. Fat, as I said, is a fuel. And that's how all the processes in our body will go on. Insulin regulates all the metabolism of the liver. In fact, it regulates fat, cholesterol, and protein metabolism. So it is very crucial to regulate insulin levels in our body by the diet that we eat. So systemic harm, as I said, is not due to fat consumption, but due to excess carbs consumption. So how do we manage? We have to manage our comorbidities. We have to optimize our blood sugar levels. HbA1c should be less than 5.2. Lower the triglycerides to less than 100. Increase the HDL to more than 60. Normalize the blood pressure to less than 120/80. We have to monitor regularly the liver enzymes and do a yearly ultrasound scan. So this is how you manage your NFLD by a lifestyle thing. How do we reserve it? So we have to follow a low carb, high fat. So it can be animal based or plant based. It is not only animal based. So there are people who can manage with plant based diet as well. And so what happens? We shift from sugar burning to fat burning. So insulin decreases and your appetite is suppressed. And because of this, you can do intermittent fasting. That is how you can go without food for a longer period of time. You can keep a short window period, 12 to 12-hour window period, 12-hour window period of eating and 12-hour of fasting, or 8-hour window period of eating and a 16-hour window period of fasting. So leptinoids are just hormones which will they are hormones that react to fats when you eat. They give you the long period of satiety that you feel full. So you don't tend to have 6 to 8 meals per day. So your meal time should be either maximum 3 or 2 meals per day with no snacking in between. And yeah, so that is about that and about the physical activity. It is very important to be physically active so that your glycogen reserves are used and your fat is burned. So that is the thing behind exercise. So let me show you the medications and supplements that is needed. We have to take enough salt. Metformin is one drug which will help to increase your insulin sensitivity. Aspirin, vitamin D supplements, vitamin B12, and omega-3 fatty acids. So this is a food pyramid that we need to follow. The base of the pyramid is plant foods and animal foods, followed by fat fortifying your food with olive oil, butter, eggs, bacon, cheese, nuts, and seeds. By doing intermittent fasting, that is eating sequentially, you can drink, you have your bridge drinks like coffee, water, green tea, have a relaxing time with your family, and have adequate salt. So we as a community help by educating and supporting you in your health journey. A proper human diet really matters, and that's the point we are trying to get across to people. So as you are interested in this or you want to embark on your journey to improve your health, you need the support of a community of like-minded people for support, for questions, for doubts. So I suggest you make your choice, and choice also matters. So thank you. If there are any questions, definitely we can.
Yeah, it was a great information, a short and sweet presentation and a detailed, we can say. So anyone who has doubts can raise your hands as so that we can, she will give you, Dr. Vincy can answer your questions. You can raise your hand so that I can unmute you. Anyone? So the gist of Dr. Vincy's, session is what we found out is like fatty liver or non-alcoholic fatty liver, NAFLD, is not a disease. It is a disorder which can be ordered by changing your lifestyle. So just by changing your lifestyle, by reducing a high carb food and increase your protein and good fat, if you are including all these things in your lifestyle and having a proper sleep, a good exercise, all these things are going to reverse your fatty liver. So fatty liver is not a disease, it is a disorder. So very clearly she has mentioned. Yes, any doubts you can ask.
So somebody has asked whether NFLD can it be hereditary. So it's unlikely that it's hereditary. It's a lifestyle disorder and not a hereditary disorder. It's not genetic. There must be very 5% cases where there are genes which you can tend to get it, but definitely you can delay the process. But it's a very minimal percentage. What are the foods to avoid during high? What is that?
Just a second.
LFT. It seems.
What are the foods to avoid during high liver fail? What is that LFT? I did not understand. Fatty liver. Okay. Fatty liver.
So as I mentioned, it is mainly carbohydrates, foods that are very high in carbs, especially your grains. You understand?
Indumati, you can unmute and you can speak.
Thank you, Dr. Vincy.
Yeah.
I recently I was diagnosed to have a fatty liver.
Yeah.
But my lifestyle, I don't take too much of carbohydrates. Like I do intermittent fasting, like twice a day meal. I take a lot of fiber, but I do have a slight kind of abdominal pain. So I'm wondering whether it's associated. And I don't like sweets either. I just take 1 teaspoon of sugar in the whole day. But I do take dark chocolate sometimes. So how else can I modify my diet? I'm not sure like what more I should do to, how
So
far gone I am in this fatty liver thing. And of course, I am diagnosed with diabetes recently. So I'm on, diabetic medication. So
So
yeah, these are my.
basically, you will have to get in touch in the sense we need your blood tests and we need to your 24-hour diet recall we need to do and figure out what are the foods that you need to avoid and how much you're
Okay.
taking, how much protein you're taking. You know, protein per at least 1 gram per kg per day is very essential for us. So are you taking enough proteins and fats also? Fats are also essential. So
Yeah, I kind of, because I'm a vegetarian, so I do focus on my protein intake. I do because there is not much change my lifestyle. I mean, all those years. So I have been focusing on the protein and less carbs, more fiber. Uh, Yeah, enough. Is it okay to take cheese and all that? Because I'm really fond of cheese.
Yeah, absolutely. It is good because that is the protein source, one of the protein sources.
But yeah, but won't that get my cholesterol up?
No,
That's
it
my
won't. Yeah, that's
butter
what
and
I'm trying to say, that fat consumption is not going to increase your fat in the blood or in the liver. So fat is
okay.
not the problem. It is a high carb diet. The chronic consumption of high carbs is the problem. It's the carbohydrates that get converted to fat and not the fat which get converted.
Got it. Got it. Thank you very much.
Yeah, Indumati, you can contact the person who have invited you to the session, so we can connect and then we can have a good discussion. Okay, we can have a one-to-one consultation too.
So there's one more
Yeah, thank
question.
you.
Yes, Dr. Vinci, one more question. Is there any proven detox regimen to maintain liver health, especially for those who cannot do intermittent fast?
Yeah, so for them also, I would suggest only lifestyle diet. I'm not aware of any proven detox regimen. We just go with our daily diets about how we manage our macronutrients, that how much carbs you can eat, how much protein you should be eating, and how much fat you should eat. So we just focus on the macronutrients and the micronutrients as well. So you get your nutrition, daily dose of nutrition, as well as your macronutrients. So that's what we focus on. It's just your health is in your kitchen. We don't have to go for any detox regimen, any hi-fi stuff, protein powders, nothing. That's the message that we are trying to put across.
How can a person with stage 2 fatty liver disease deal with it?
Absolutely. Like how I said, I showed you the food pyramid, right? The base of the food pyramid is all plant and animal foods. Fat, fortifying everything with fat and enough salt with intermittent fasting will resolve the fatty liver. So to change to such a lifestyle it's not easy. So that's why we are there to help you through this process. We'll guide you like what you should eat and you should avoid, how much water you should drink, the electrolytes that you need to drink with water. So when you're changing your diet. So there are many important things that have to be done along with diet change. So up to stage 2 fatty liver is definitely reversible.
Any other questions? Okay, now can we close the call? Okay, now whoever has invited you to the session, so I would like to contact them, I would like you all to contact them and get the information. And if you want a one-to-one consultation, yes, can be done. So how can you manage a person with stage 2 fatty liver? It's the
Yes,
same thing.
yeah, we
Just,
answered. Yeah.
just now, Dr. Vinci had answered. Wellness coach, and yes, exactly. So you need a wellness coach and you need a consultation. You can do one-to-one consultation, and other things like if you are having any of you are having a blood report with you all, and you can just relate to yourself. Like if you are having any of these symptoms, then you can say that you are having fatty liver. So just bring your reports, blood reports, and consult to the person who have invited you to the to this session. So thank you, Dr. Vinci. Any other doubts? If you are having, please raise your hand.
Hi, I
Yes.
wanted to ask something. I've asked in the chat. I just wanted to know if a LCHF or a keto diet on a long term,
Yeah.
would you recommend a long term keto or a LCHF diet?
Yes, I would recommend that.
You're saying a complete say like whoever I have gone to, they have always suggested not to do a keto or an LCHF diet for more than 3 months. I'm well aware of the positives of keto and LCHF, but the ones whom I've asked have already always recommended me that once you lose the weight, you should come back to a normal diet. But again, the problem with the normal diet is the moment you introduce your carbs, you're back to square one.
Yes. So I can give you my example. I'm on you may say a keto diet, you may say animal-based diet, you may say whatever diet. I'm on it for around a year and a half now.
Okay.
So I have not faced any problem. Maybe I should next time I can share my bloods. It's all
Yeah,
possible.
because I just wanted to ask, because I've been on and off
Yes.
keto, but my husband is continuously on a keto diet, like
Yeah.
on and off, but very much, and his blood works are much more normal than mine.
Yeah.
So the moment I start back, but I had some issues like hair loss, or little issues were there. But I just wanted to know that, would you suggest like a completely, like for his entire life, can he do keto? Because that's
Absolutely.
where everybody has an issue. Oh my God, so much butter you're having, so much fat, or cheese you're having, wherein you have cut down your carbs, but still everybody finds it very odd that you are doing keto and having such a big intake of fat.
Yeah, that's where we are trying to break the ice, because that is the most appropriate proper human diet possible. That's the
Okay.
best way I can say. So when you take it for lifelong, you're going to be healthy lifelong. You're going to get your lifetime of health. So where you are not going
Okay.
to attend, you don't have many hospital bills, you don't have your monthly medication bills, you don't have so many bills like that. You're going to be
Okay.
relatively healthy in a way. You're going to
Okay.
miss your strokes, your heart attacks, your artery blockings. This is
That's where the problem is, like wherein you're having more of fat, so people scare you saying that, oh no, you will have
yeah,
problems with your heart, or your cholesterol will increase because
that's
of the increase of fat.
yeah. So that's the narrative which has been come so far. And I would like to mention one study which was done recently. They looked at people with heart attacks, and they looked at their cholesterol levels. So what they
Mm-hmm.
found was the people with the high LDL. That's what people fear, right?
LDL, yeah.
The high
Correct.
LDL and the low VLDL ones are the most longest living people.
Okay.
The highest LDL and the lowest VLDL, and obviously the
That's
low
interesting.
triglyceride and the high HDL. These are the people
Mm-hmm.
with the living the longest and no heart attacks. Whereas if you see people who have heart attacks, their LDL levels are all low. They don't have high LDLs.
Okay.
So if you
Okay.
say, I am on this keto diet for the past a year and a half, my LDL levels are 280, but I'm not worried that, because that is not a marker of heart disease. My
Okay.
triglycerides are 57, but my HDL is more than 100. So
Okay.
even though I am taking a high fat diet, just
Would you recommend butter coffee? Sorry, I'm so sorry.
yeah. I mean, that is all a part. I think maybe we can discuss all that.
Sure. Thank you
When
so
you
much.
when you
Thank you.
take a one-to-one consultation, that can be
Sure.
good.
Thank you. Thank you.
One more question, Dr. Vincy. I just now joined. One of my family member diagnosed with fatty liver by ultrasound. All blood work is normal.
Yeah, so
Do.
so the ultrasound definitely shows fatty liver, which has to be dealt with for sure. So at least the blood work is normal. So there is a very good chance of reversal.
And one more question is, my daddy having three stage fatty liver. It's possible. Is it possible to reverse? What kind of foods to avoid?
So that's all that we discussed. Any stage, there is no harm in doing the diet that I have discussed so far.
See, whoever is like who are having the problem, please approach us with the report so that we can just check your reports and we can have a one-to-one consultation. Because by giving the statement, we cannot tell you what type of food you can have, because it will be a customized diet meal plan based on your blood work. Okay. Yes, I think we can end the call. Any questions? Any more questions? Okay, so we can end the call. As I told you, please contact your coach or the person who have invited you. And it was a great session, Dr. Vincy. And we can have more and more sessions from Dr. Vincy with different topics. So thank you, one and all.
Yes, Sandhya.
Thank you.